Jason Fallick. For my Module 2, I will be talking about PALS for my EMS topic. PALS stands for Pediatric Advanced Life Support. It's basically finding a child in arrhythmia, child without a heartbeat, child who can't breathe, child who is near drowned, and performing our ALS on the children to save their lives. There's something called a Brazel tape. Brazel tape is a way of gauging what amount of drugs to use. What they do is they have many colors. You put the head, which is actually labeled head, of the Brazel tape at the head, stretch out the tape, whatever color the feet lie. It tells you every drug, every tube size you need if you have to intubate, and that is what you follow in doing PALS. I have an example of a Brazel tape. This is something my hospital gave to me that I work at. I actually take this along with me on my ride-alongs for quick access since I am officially not hired yet. This way it comes in handy. To give you an idea of the colors, olive green is less than 1 month, light pink is 3 months, red 6 months, dark purple 1 year, yellow 2 year, white 3 year, light blue 5 year, orange 7 year, dark green 10 year, dark blue 12 year, dark pink 17 years, and then blue is an adult. Some cities say that the pediatric cutoff is 8 years old, some say 10, so you have to check your city's protocols. For the purposes of this discussion, we will say 8 is a ped. That is what I learned in school. I wanted to go over a chart that I drew up for you. This is, if you can memorize this chart, it is a quick way to go into a PALS emergency and know what drugs to give. The drugs given are in milliliters. You need to make sure you still know the formula for when you're giving an ENCODE. Up top, I put age in odd numbers, 1, 3, 5, 7, and 9. The average weight for those years are 10, 15, 20, 25, and 30 kilograms respectively. As mentioned, the drugs are in milliliters. The first two are epi, because epi is like Kool-Aid for children. Epi 1 in 1,000, what you're going to do is you're going to take the kilograms and move the decimal over 2, so 0.1, 0.15, 0.2, 0.25, 0.3. For epi 1 in 10,000, you're taking the age in kilograms and moving the decimal over 1. So it's 1 milliliter, 1.5, 2, 2.5, and 3. Amiodarone is the exact same as epi 1 in 10,000. For atropine, you're going to take what you wrote down for amiodarone, you're going to multiply it by 2, so 2, 3, 4, 5, 6 milliliters. For D25, you're going to take what you wrote down for atropine and add a 0, 20, 30, 40, 50, 60 milliliters. For normal saline, which is also the same as calcium chloride, you're going to take what you wrote down for D25 and add another 0, 200, 300, 400, 500, 600. The two at the bottom don't flow like the rest in the chart, Valium and adenosine, but they are commonly used. I wrote them down, they're just easy to be memorized. I came up with a formula for Valium. It's basically the age plus 3, and then you move the decimal over. And then adenosine, you just have to memorize what they are. Using this method, this chart, gives you an edge when you go into any pediatric scenario. You already know the amount of drugs you have to do and give, and you'll most likely be able to save their life, hopefully. I hope you enjoyed my topic on PALS. See you soon.